later. And so we start with the first slide. And well, so do you see the first slide?
Yes, ma'am.
Okay. Today we are going to speak about explaining and reassuring, and this is the unit 4 of the book Medicine 1, English for Careers book that we study with them. So first of all, I would like to give some comments on your homework. When I was checking the papers which you uploaded to the Moodle site, there was a problem with some of the papers, with some of the screenshots. So that is, I wasn't able to read it from the screen. So that is why I should say, when you upload the screenshots, make sure that you use the correct scale. I mean, it should be visible in the window which opens here on my side. So the scale should be, I don't know, 100 or even less. Otherwise, it's hard for me to read it. So, I mean, that problem was not just with only some papers of several students. Most of the papers were okay. And so there is another just case when the paper, the text is also not visible. You should just make a bigger scale that it could be read from the screen. So check this when you have uploaded the screenshot on the site. Or so like this. So I can't read it. So I need to download the screenshot on my computer, which takes time and no, not convenient for me. And so as for the task that we did, the previous task, so as you remember, the task was to write the instructions to a patient about cannulation, IV cannulation. And the key phrases that you should have used in the instructions are given here. I mean that these are the phrases that you explain the procedure to a patient, not just to your colleague or someone else, but to someone you teach. But we were speaking about being polite and reassuring, and you should just encourage your patient. And so the phrase is like this: now I'm going to insert the needle to the vein. I would like you to hold your hand still. So very good phrase, very polite formula. All the elements that we were speaking about are here now, and I would like, or another example, Mr. Alex, could you please adjust yourself to a comfortable position? Yeah, that's it. Now I need you to stretch your hand for me. So also, could you please, that's it. Now and for me. So that are the phrases, these are the phrases that I asked you to use in your instructions. And another example, if you don't mind, can I stretch your hand distally? Okay, thank you. And so on. All the necessary elements. And I would like to say that most students understand the difference between describing the steps of a procedure to a colleague, to someone you want to teach, which is given in short imperative sentences, and giving instructions to a patient using polite and simple language. So here we have such examples like wash your hands, put on your gloves and prepare the things for the IV cannulation. Ask the patient to stretch their hand to put the IV cannulation in the hand. Are these instructions for a colleague or for a patient? 5 and 6. Hello?
These instructions are for a colleague.
These instructions are for colleagues.
Yes, yes. So you don't use any polite words. And the phrase at the bottom, I need to put the IV cannulation on hand, so if you could stretch your hand for me, please, thank you. This is for so this is instructions to a patient, right? Because you ask, you want to be polite, you ask this person to do something for you. And the question was, that some of the students got 5 points out of 10 because maximum score was 10. So now I think you understand your mistake because you didn't use polite formulas, or you just gave instructions to another doctor or to a nurse or to a colleague. So you just copied the information from some resource without any changes. That is why you got less score for this task. So do you understand? Is it clear?
Yes, ma'am.
Yes, ma'am.
Okay. So, well, and so for the questions to the text DOPS, there were no problems with this. So you answered all of them, and you've got maximum score for this. Now let's just start speaking about how to explain and reassure. And I would like you to have a look at the picture. So there is some kind of scary instrument. And the question is, which procedure do you think is about to take place here in the picture?
This is endoscopy.
Endoscopy, yes.
Yes, ma'am.
Or gastroscopy, right?
Or this or gastroscopy.
Mhm. And
These are
yes.
these are the instruments which is used.
Mhm. Well, the question is, what do you think the patient's reaction to the instruments and the situation would be?
The patient
Yes.
the patient might feel like, what is this, because patient is not aware of what kind of instrument is this. Only doctor will be advising him or telling him or her that this is this and that type of instrument and we will do this procedure on you. So he or she, that patient, is completely confident about his doctor. So they leave up to them. So this is what I guess the patient's reaction would.
Okay.
Yes.
So what are the other feelings the patient can experience?
Like
Every patients may have different reactions towards their instrument. Like some may be frightened, and some may be like a little nervous, but sure, like they will be well after the surgery. Like they may have the multiple means reactions in different
Exactly.
patients.
Mhm, mhm.
The
And
patient might
yes,
the
please.
patient might feel distressed, ma'am, seeing such
Mm.
weapons.
Hmm.
Exactly. Mm. Okay, and what about the doctor's reaction?
The doctor
Well,
is
doctor is
known
sure
of
about the
all the
surgery.
instrument, and
Hmm.
they are
He
like
knows how to
my
operate it.
they are like my patient should understand me what I'm saying, and doctor feels like doctor that I can easily make the patient understand what these are and what I'm going to do. If the patient will understand or not, will they cooperate with me or not,
Mhm,
doctor can think these things.
mhm.
Doctor's reaction is
Yes.
very assuring, ma'am.
Mhm.
Hmm.
Yes, this is the
Their
doctor's
confidence in
job.
their skills.
The
Mhm.
doctor
Yes.
is quite confident about the instrument and how to use it. He knows that the person will be fine after the surgery.
Mhm, exactly
Yes.
right. Okay. Mhm. So, and you already said that different that the patient's reaction to instruments is very diverse. So it depends on the person. Okay.
Yes.
Well, and so as you see here on this slide, there is information about different kind of procedures that have the names of procedures that have suffixes. And to the right, you can see these suffixes: ectomy, oscopy, ostomy, otomy. And to the left, yes, to the left, yes, and to the right, there are some definitions for these. What can these suffixes mean? And our task is to match each suffix, which describes a surgical procedure, to the correct description. So have a look at the definitions. And so let us listen to Arun Chalam. What do you
Yes,
think
ma'am.
of the
Ma'am,
first?
the first one is ectomy, ma'am. It is a removal of a structure by surgery, ma'am.
Okay, so can you think of any examples with such a suffix?
Ma'am, like vasectomy, splenectomy, removal of the human things,
Okay,
ma'am, after a certain age.
great. Thank you. Now, Madhumita, what about the second suffix?
Second one is oscopy, ma'am. It is act of examining.
And examples?
Mm, laparoscopy.
Mhm. Okay.
Laparoscopy.
Great. Well, then please, Divya, number 3. Divya, are you with us? No, Divya. Well, Priya.
Yes, ma'am. Ostomy means an opening between two cavities or the inside. And examples of colonostomy, ileostomy, and urostomy, ma'am.
Great, okay. So, and the next is for Rajkumar. No, Anas. Badris. Okay. Arunchalam, do you know anything about these guys? Like they do not submit any tasks and do not attend the classes. So,
Ma'am, yes, ma'am, I spoke to him, ma'am. He didn't give any response, ma'am. I have complained to advisor, and I'll get the news about him very soon, ma'am. I'll let you know, ma'am.
thank you. Well, so Prerna, please, number 4.
Yes, ma'am. Number 4 is Tommy.
Mhm.
The Tommy means Tommy is no, I guess a
Ma'am, can I?
removal of structure by
Cutting something open.
Cutting
Cutting
something
something
open.
Cutting something
open.
open, and
Mm.
the example.
Maybe
Corneotomy, ma'am.
Gastrectomy,
gastrectomy,
Corneotomy.
ovariotomy,
Gastrectomy.
cutting of
especially
Vasectomy.
gastrectomy.
lobotomy.
Lobotomy, yes. Okay, thank you. And well, so, and if we move to the next slide, we need to focus on the pronunciation and the word stress in these medical terms. So the question is, what is the stress pattern for each of these words? The stress pattern is where the stress is located in these words. I mean, which syllable? The first, the second, the third syllable. Now we are going to, yes, listen to Nishat. So
Yes, ma'am.
can you read these words?
Ma'am, endoscopy. Ma'am, like DOS, ma'am. DOS, the stress is focused on
Then
DOS.
the next word, please, all three words.
Yes, ma'am. Endoscope, ma'am. The word is stressed on DOS and DOS, ma'am.
And the second and the third,
And about second, ma'am. Ma'am, DOS, ma'am. It is only that.
and the third.
Endoscopy. And third, ma'am, is endoscopic, ma'am.
Mhm.
Also, ma'am, DOS and PIC, ma'am. PIC.
So let us check. So let's listen to the pronunciation, correct pronunciation, and you say, you'll tell me if you hear or not. Well,
Unit 4, Pronunciation. Unit 4, Pronunciation.
do you hear?
Yes, ma'am, we can.
Yes, ma'am.
Okay.
Unit 4, Pronunciation. Exercise 3. 1. Endoscope. 2. Endoscopy. 3. Endoscopic.
Mhm. You see that in the first word, the first stress, the first syllable is stressed, then in number 2, the second, in number 3, endoscopic, the third syllable is stressed. Well,
Yes.
and this is the illustration to to the stress in different words, in different terms. You see the bigger just circle is for the stressed syllable and the smaller ones for unstressed syllables. Now we are going to listen and write the words that you hear next to the appropriate pattern. So you'll need something to write on. Just prepare the paper, and now we'll listen, and then we'll discuss which words should be written on each line. So now let's start.
Exercise 4. 1. Endoscopy. 2. Proctoscope. 3. Gastroscopy. 4. Colposcopic. 5. Gastrectomy. 6. Proctoscopic. 7. Gastroscopic.
Well,
Ma'am, can you please, ma'am, can you please replay the word?
yes,
Yes, ma'am.
one more time.
Exercise 4. 1. Endoscopy. 2. Proctoscope. 3. Gastroscopy. 4. Colposcopic. 5. Gastrectomy. 6. Proctoscopic. 7. Gastroscopic.
Well, let us listen to Nishat.
Yes, ma'am. The first one is, ma'am, gastroscopic, ma'am.
The first line, you mean?
Yes.
So do we all agree that gastroscopic should be written
No,
on the
ma'am.
It
Ma'am,
was
endoscopy.
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 So sorry,
Endoscopy.
ma'am. Endoscopy, ma'am. Yes. And the stress is on DOS, ma'am.
The stress is on the first syllable, and the word that goes
Second.
here, this is the proctoscope. Proctoscope. This is the only word that should be written on the first line. Okay, what about the second line? And let us listen to Prakriti. Which words did you write on the second line?
Ma'am, the first word is endoscopy, ma'am.
Ma'am, first one is a endoscopy and second one is a proctoscopy.
No, it should be endoscopy, gastroscopy, and gastrectomy. Yes. So
Yes,
because the stress is on the second syllable. And about the third line, let's listen to Samhita.
Yes, ma'am. The third line, we should have words colposcopic, gastrotomy, proctoscopic.
It should be colposcopic, proctoscopic, and gastroscopic.
Gastroscopic.
So the adjectives,
Yes, ma'am.
actually.
Yes, ma'am.
So, and we should be very careful with the stress when we use these specific medical terms. Well, and
Exercise 4.
so this is the answer. You see? And let's move on. Here we can see a couple of medical instruments. They are proctoscope and bronchoscope. And so the question is, what is the purpose of these instruments? So, Rafael.
Yes, ma'am.
What can you Rafael?
Yes.
So, Rafael?
Am I audible, ma'am?
Yes, now it's better.
Yes, ma'am. Ma'am, proctoscopy is used to examine the inside of anal, ma'am, or the rectum, ma'am. And bronchoscope, ma'am, it is used to examine the bronchi of the lungs, ma'am.
Okay. So, and so we're going to listen to some information that. So Dr. Quinn is explaining how the gastroscopy is performed. And we should make notes about the 3 pieces of advice that he gives to his patient before the procedure is carried out. Antacid therapy, eating, and driving. And here's also the diagram, which just helps us to remember what the procedure looks like. So what is done during the procedure, the purpose of the procedure. Now let's listen and make notes about these 3 issues. Okay, now.
Listening 1. Once the procedure is explained to the patient, advice is given about what preparation is required before it is carried out. The patient is asked to stop anti-acid therapy for 2 weeks beforehand if possible. For eating and drinking, the patient is advised to take nil by mouth for 8 hours before the procedure is done, but note that water up to 4 hours pre-op may be okay. As regards driving, the patient is advised not to drive if sedation is involved in the procedure. A leaflet about the procedure is always given to the patient, and follow-up is also.
So, did you get all the information, or do we need to listen for the second time?
Yes, ma'am. Can we listen?
Okay.
Listening 1. Once the procedure is explained to the patient, advice is given about what preparation is required before it is carried out. The patient is asked to stop anti-acid therapy for 2 weeks beforehand if possible. For eating and drinking, the patient is advised to take nil by mouth for 8 hours before the procedure is done, but note that water up to 4 hours pre-op may be okay. As regards driving, the patient is advised not to drive if sedation is involved in the procedure. A leaflet about the procedure is always given to the patient, and follow-up is also.
Well, now let us listen to Aymin, please, about anti-acid therapy. What does he say?
Yes, ma'am. Ma'am, here doctor is explaining about giving instructions about gastroscopy. So he said about anti-acid, ma'am, he said that if he is taking any anti-acid therapy, it should be stopped before 2 weeks of this examination.
Great. So about eating, Arunchalam, what does he say about eating?
Yes, ma'am. He said that the patient should not eat at least 8 hours prior to the gastroscopy, ma'am, and water for 4 hours, ma'am.
Before the procedure. Okay.
Yes, ma'am. Before the procedure starts.
Thank you. So about driving. So let's listen to Madhumita.
Yes, ma'am. You shouldn't drive after the therapy, ma'am, as you may feel dizziness.
Because of what?
Sedative.
Because of
Sedation, ma'am.
Sedation. Yes.
The patient is not advised as sedation is involved in the process.
Involved in this process, that is why it's not advised to
Yes,
drive.
Yes.
Okay. And now, so we've listened to the doctor. He was explaining, was he talking to a patient or a colleague?
A patient, ma'am.
Colleague, not
colleague.
A patient.
not patient.
It's not easy to guess because he was just explaining the process, the procedure. Okay, in very business-like manner, and when he was talking, he used some specific forms of the verbs. What verb forms are used by the doctor? Did you notice this? Do you remember? Okay, no reply.
Ma'am, like asked to stop the verb.
Advised.
By mouth.
I see.
Advised not take in on, not to drive on sedations.
I see. Okay, but the doctor also used.
Listening 1.
I mean, this kind of structures like passive voice. So, and if you have a look at the picture which is given here, you can see the illustrations, the sentences that illustrate this form, like the cat drank the milk because it did it itself, drank, this is active voice, and the baby is unhappy because the milk was drunk. This is the passive voice. the baby didn't do it itself, so it was done by somebody else, was done. This is passive voice. And if we move to the next slide, we can see the information about, this is the language part, and about explaining investigations and procedures with the present passive. So when we use active voice, active sentences say who is doing an action. I mean that we use the subject, the person who does the action, and the verb that shows that this person is doing this action. Passive sentences don't necessarily say who is doing the action, though they can say this. And if we focus on the form of the passive voice, so it consists of at least two parts. It should be the verb to be in different forms, like am, is, are, and the main verb in the third form, participle to. If it is a regular verb, so V stands for verb. If it is a regular verb, we add ed. If it is irregular, we use the third form, like work, worked, or write, written, the third form of irregular verb. Well, and so if we speak about positive form, so here there is information about verbs not requiring objects, by whom the action is done. It is not necessary to use them. And examples. Example of the active voice: the doctor attaches the needle to the syringe. He does it himself or herself. This is active voice. And the passive voice: the needle is attached to the syringe by the doctor. So the needle doesn't do it itself. It is done by the doctor. So the subject is placed on at the beginning of the sentence, and so the verb is used in the passive voice. The verb to be in the form of is and attached in the third form. I mean participle to. And so the note says that we don't need to say who it is done by, because it is part of a procedure. So we are not interested in this. Well, and if we have a look at the negative sentences, in the active voice, there is: a doctor does not use a tourniquet in this procedure. So doctor does not use himself or herself. And passive voice, we place the word procedure. It becomes the subject of this, the word tourniquet. It becomes the subject of the sentence, and tourniquet is not used in this procedure. So is not used. This is passive voice. Well, and here's the information about the verbs that require objects. So by is necessary here. Active voice: only experienced doctors perform this procedure. And passive voice: this procedure is performed only by experienced doctors. So by is necessary to use here. And the negative form: nurses don't perform this procedure. And passive voice: this procedure is not performed by nurses. Well, if we move to the next slide, there is information about there are some practical exercises on the use of the passive voice. Here we need to change the sentences describing procedures into the passive voice. And we should decide whether they require an agent or not. Agent is a person who does the procedure. So it will take just more than 2 minutes. That is why we have to take a break now, and we'll continue after the break. Okay?
Okay, ma'am.